Today we'll study anti-malarial drugs. Okay, please subscribe channel. It takes lots of effort to make a videos. If you are informative, if the video is informative, please subscribe channel. Okay, thank you. Now today we'll study the anti-malarial drugs. Okay, in today's class we will study the definition of malaria according to WHO and the anti-malarial drugs, the definition of anti-malarial drugs and causes of the malaria and transmission of the malaria, and what are the species of the malarial parasite and the life cycle of malarial parasites and stages, what are the stages are there. Okay, that we will study. Along with that, the therapeutic classification of drugs, that we will study, and the next one, the chemical classification of the antimalarial drugs along with some Ayurvedic drugs. Okay, those are useful in the malaria, that we will study in the today's class. Okay, the first thing, that what is malaria according to WHO, the malaria is a life threatening disease caused by parasites. Okay, it means it is caused by parasites that are transmitted people through the bite of infected female Anopheles mosquito. Okay, this is the life threatening disease that is caused by parasites and transmitted through the bite of female, okay, infected female Anopheles mosquito. Okay, this is about the malaria. And here the malaria, the symptoms are the fever with chills, that is joint pains, headache, muscle pains, vomitings and fatigue. These types of the symptoms you can see in the malaria. Okay, now if you diagnose the malaria, then what are the symptoms? Okay, what are the how you will manage, that we will study in the today's class. Okay, the first of all, the definition about the anti-malarial drugs, that we will study. Here the drugs used for the prophylaxis, treatment and prevention of the prevention of relapse of malaria is called as a anti-malarial drugs. It means here three things the drugs is given. Okay, the acting, the first of all, the prophylaxis, that is the preventing the malaria, and second one, the treatment, if the symptoms are arises, the symptoms are treating. The third one, that is relapsing the dormancy period, again it is active the malarial parasite. Okay, again it is relapsing again and again. How we have to treat, that is about the drugs. Okay, here the anti-malarial drugs are those, here the prevention, treatment and relapse. Okay, those are suppressing, those drugs are called as a anti-malarial drugs. Okay, about the drugs for the prophylaxis, treatment, prevention and relapse of malaria, those drugs are called as a anti-malarial drugs. Okay, now come to the causes. What are the causes about the malaria? The causes are mainly the four species are there of protozoal parasitic plasmodium. Here the plasmodium is the causative factor. Here it is a four species. The four species are there. Okay, those four species are, that is Plasmodium falciparum, Plasmodium vivax, Plasmodium ovale and Plasmodium malaria. These four species are the causative factors for the malarial parasites. Okay, malaria. And here the transmission, the malaria is transmitted through the bite of female Anopheles mosquito. Okay, the bite of, whenever the female Anopheles mosquito bite, then it is transmitted from the one person to the another person, infected person to the another person. Okay, this is about the transmission. Now we will study the life cycle of the malarial parasites. Okay, life cycle of the malarial parasites. Here the mainly here two hosts are there. The first one, primary host. The primary host means that is the person, that is the in which the primary host in which the sexual reproduction is produced, that is the female Anopheles mosquito, and the secondary host is, that is the human. Okay, here asexual reproduction is there. Okay, the first of all, the primary reproduction. Okay, that is the primary host, that is the female Anopheles. Here, what happened? When mosquito bite, then sporozoites enter in the human body. Okay, it means that the female Anopheles mosquito, when it bites, then it release the sporozoites in the human blood. Okay, in the human blood. Okay, if whenever the human blood it enters sporozoites, then it will, these sporozoites through the bloodstream, they will go to the liver. Okay, in that liver, okay, this is called pre-erythrocytic stage in the liver. Whenever in the liver it will goes the sporozoites, again it is doing two things. One, some sporozoites, those are goes to the dormancy, that is the in the resting stage, that is called as a, that is the hypnozoitic stage. Okay, that is the hypnozoites, and some are active. Okay, some sporozoites are active, those are, that is the starting multiplications in the hepatocyte. Here in the liver, it starts the multiplication and burst, then after the bursting it will again it will spread in the blood, it will goes in the blood, and then it enters to the red blood cells or attacks to the red blood cells, and it converts into sporozoites, convert into merozoites. Okay, here these merozoites get mature in the red blood cells. Okay, the red blood cells are nothing but the erythrocyte stage. Here it is mature. Okay, after maturations, the again the red blood cells, the erythrocyte, it's mature, again it is burst. Okay, when it is burst, it is again two types, that is the, some are producing, that is the RBC rupture and release merozoites, erythrocyte is schizogony. Here it is two things happen, one is, that is the, it is mature, and another one is that is gametocytes is produced. Okay, the gametocytes, the merozoites differentiate male and female gametocytes, and that is the gametocytes entered into the mosquito. What it means, that is the, in the red blood cells, that is, it is ruptured. Here whenever it is ruptured, the male and female gametes are produced in that stage. Okay, in the RBC, that is the gametes are produced, male and female gametes. Okay, those are merozoites, and it is ruptured and entered into the bloodstream. Okay, entered in the bloodstream, again it will come to the bloodstream, when again, that is the not infected, then another mosquito bite to the human beings, that is the, in that gametocytes are there, that is sucks again the male and female gametocytes, that mosquito sucks, and that mosquito is infected. Okay, that sucked the male and female, that is zygotes form, in that sexual reproduction is continued in the mosquito, and it is sporozoites is produced in that mosquito. Again, if whenever it bite to the next person, in that the cycle will repeat. It means that infected mosquito bite, then it goes to the bloodstream, in the bloodstream, okay, it will goes to the liver, and liver, that is the, that is called sporozoites, in the liver it is converts into, that is the merozoites, and again it is that is the multiplied and produce gametocytes, that is male and females, and here again it is, that is the porogony, that is stage, and again it is when a new mosquito bite, new female Anopheles mosquito bite, then this cycle will repeat again and again. Okay, this is about the life cycle of the malarial parasites. Okay, now we'll study the next thing, that is a stage. Okay, stages of the malaria. Here it is mainly classified into 4 stages. The first one is the pre-erythrocytic stage. Erythrocytes means red blood cells, that is before entering the red blood cells, that is called as a pre-erythrocytic stage. It is the main, whenever you will destroy the this stage, then you will get the result, that is the prevention, prevent the cause of the malaria. Okay, it means before entering the red blood cells, if you destroy, then you can prevent the malaria symptoms. Second one, exoerythrocytic stage, that is It is also called as a hypnozoites. In this stage, if you will destroy, then relapse you will not see. Okay, this is the exoerythritic stage. Next one, erythrocytic stage, that is whenever the sporozoites entered, that is the in the blood cells, RBCs. The third stage is erythrocytic stage. Here the symptoms are produced. The mainly the malaria symptoms are produced in this stage only. You can see here fever, chills, arthalgia, headache, myalgia, vomitings, fatigue. These are the symptoms are produced in the erythrocytic stage only. Okay. The next one, 4 stages, that is the gametocyte stage. This is the male and female gametes is produced. Okay. After in the RBC, in that rupture, then male and female gametes produced. It will enter to the bloodstream. Again, it will malaria, that is Anopheles female anopheles bite, then transmit the next person. Okay, this is the 4 stages. Okay, if you want the treatment, if you treat in this stage, you can prevent the cause of malaria. Okay, pre-erythrocytic stage. Second one, the exoerythrocytic stage. If you act on this stage, then relapse, we can prevent the relapse. And third one, erythrocytic stage, the symptoms, that is your whenever patient come to your hospital clinic, this is the patient is come in this stage, erythrocytic stage. Okay, if you destroy this stage, then symptoms will suppress. The next one, gametocytic stage, the transmission in this stage, if you act, then transmission you can stops or prevent. Okay, this is about the 4 stages about the malaria. Okay, or that is the called as a plasmodium. Now come to the therapeutical classification of the drugs. Okay, therapeutical classification, it is again 4 types. Okay, like this stages. The first of all, the casual prophylaxis. Here the casual prophylactics, here it destroy the parasites in liver cells. Okay, it means it destroy the parasite in liver cells and prevent the invention of the erythrocytes. What happened here? It means that it prevent the cause here. Okay, it means that before entering into the RBCs, you can destroy in the liver only. Okay, this is the first stage, the cause of the prophylactic, that is prophylactics. In this stage, you can destroy before entering into the RBC. Okay, this is first stage. You can prevent the invasion of the erythrocytes. Okay, this is the drugs. What are the drugs we are using? Primaquines and pyrimethamine. These drugs are there. That is helpful in the treating the causal prophylactic drugs. And the next one, tissue schizonticides. This is tissue schizonticides. It means this is the that is second. This is called as hypnozoites. Its another name is, that is the hypnozoites. It means that if you destroy this stage, then erythrocytic stage you are destroying. It means that relapse you can prevent. Okay, we can prevent the relapsing its symptoms, or we are destroying the relapse. Okay, what are the drugs we are commonly using? That is the primaquine and tefnoquines. These drugs are helpful for the tissue schizonticides. Okay, the next one, blood schizonticide. This is the blood schizonticide. This is the erythrocytic stage. This is the destroyed the parasites in the RBC. Okay, these drugs, these are destroy the RBC, that is the parasites in the RBC, and terminate the clinical symptoms. The patients, the symptoms whatever are there, that is terminating and suppressive drugs. Okay, this is the blood schizonticide. The very common drug is the chloroquine. Okay, the chloroquine is very common drugs. Other than that, that is the artemisinin, quinine and mefloquinone. These drugs also acting as a destroying parasites in the RBC. Okay, the next one, fourth one, that is the gametocidal drugs. Here they destroy the gametocytes, that is the male and female gametes. These drugs, they are destroying and preventing the transmission. Okay, preventing the transmission of the malaria. The common drugs are, that is the primaquine and chloroquine and quinines. These drugs are the gametocidal drugs. Okay, it means that the single drug is till now single drug is not there to destroy the complete cycle of the malarial parasite. We have to use multiple drugs, okay, like chloroquines, primaquines, and so many drugs we are using to destroy the complete cycle. If you are giving single chloroquine, only symptoms is suppressing. If the in the patient that is hypnosis stage is there, then again after some days the symptoms again relapse. That's why we have to give as a treatment chloroquine along with primaquines. Also we are giving the drugs. Okay, and next thing, the chemical classification. What are the chemicals, okay, are there to treat the malarial parasites? The first is that is the 4-amino quinolones. The drug is chloroquine and that is amidoquines, and second one 8-amino quinones, that is a primaquine and tefnoquines, and next quinolone methanols, those are quinines and quinidines and mefloquines, and lastly that is the sesquiterpene lactonose, those are artemisinin, artemisinates, artemether and artethers. These are the chemical classification of the drugs. Okay, and come to the Ayurvedic drugs. What are the Ayurvedic drugs which we are using to treat the malaria? The very famous, very common Ayurvedic drug is that is the Ayush 64. Okay, it is developed by CCRS. Okay, CCRS developed to treat the malaria. The very common drug is Ayush 64. Some herbs, okay, which we are using to treat the malaria, those are Kasni, Choraka, Yashtimadu, Nimba, Saptaparni, and other so many drugs which we are using to treat the malaria. Okay, this is about the anti-malarial drugs pharmacology. Okay, thank you for watching. Please subscribe channel.